Hello wonderful people, good day and welcome to this video for today once again. Okay, now in today's video we're going to be discussing about tooth sensitivity. I'm going to educate you on its causes, its type and its remedies, and I'm very sure that at the end of this video you will be educated and enlightened. Why? Because tooth sensitivity is a very rampant case and is very common in a large number of individuals, and possibly you also experience it. So this is the reason why I would love you to hold on and watch this video with me to the end. I'm very sure you will not regret it. Now, what is tooth sensitivity? Tooth sensitivity is when your teeth is sensitive to heat, cold, or pressure. Okay, now in certain cases or certain conditions, maybe when you eat food that are too hot or too cold, or you expose your teeth to pressure, maybe you're eating some foods that are too hot, too hard, you feel a kind of sensation in your teeth. Okay, and sometimes it can be so sharp and so painful that you will lose appetite for the moment and it will take you some time to recover. Okay, now this tooth sensitivity has various causes and I'm going to explain them one by one. Now the first cause of tooth sensitivity is what we call when the dentin is exposed. Okay, now what is this dentin? Normally in the structure of the teeth we have three layers. We have the enamel, we have the dentin, and then we have the pulp. Okay, now the enamel is the outer covering of the teeth. The enamel is the white part of the teeth that you and I can see from the outside. Okay, and then after the enamel we have the dentin, and then after the dentin we have the pulp. Okay, now when this enamel is eroded or damaged and then your dentin is exposed, it is going to cause tooth sensitivity. Why? Because the dentin is a sensitive part of the teeth. The enamel is an insensitive part while the dentin is a sensitive part, and normally the enamel covers the entire dentin, right? But in some cases when the enamel is damaged, dentin will be exposed. Okay, so when your dentin is exposed, it causes tooth sensitivity. Now, the second cause of tooth sensitivity can also be tooth decay or caries. As I've said earlier on, when the enamel of the teeth is decayed or damaged, it can cause tooth sensitivity because your dentin is exposed. Okay, so tooth decay or caries can lead to tooth sensitivity, and this most at times this teeth decay or caries is caused by poor oral hygiene practices and negligence of oral hygiene. Now next we have cracked or fractured teeth. Okay, now when your teeth is fractured or cracked, now maybe possibly because you are using your teeth as a tool, as an instrument. Now I've made a video earlier on about 5 things you should not do with your teeth. I would love you to watch that video so you know what not to do with your teeth. Now, but when you use your teeth as a tool to open bottles or to do other things that is not supposed to be so, your teeth can get cracked or fractured or broken. And then when these extreme temperatures come in contact with the inner part of your teeth, which is the dentin, you actually feel sensitivity. Okay, now we also have gum recession or gum disease. When your gums are infected and then you maybe because of poor oral hygiene you did not take good care of your gums or your oral cavity, and then your gums are infected or there's an inflammation of the gums, it can actually cause tooth sensitivity because all these will expose extreme temperatures and pressures to your dentin, and then your dentin will react. Okay, now we also have bruxism or tooth grinding or tooth clenching. Okay, now when you keep grinding your teeth against each other, maybe the upper against the lower, you keep grinding, as some people have formed a habit out of it. Yeah, it actually causes the enamel to erode. It actually causes the enamel to be depleted, and then when your enamel is depleted, it exposes your dentin, and this can also cause tooth sensitivity. Okay, so if you want to stay healthy, if you don't want to experience tooth sensitivity, you have to, as much as possible, avoid all these causes that I mentioned. You have to avoid tooth grinding, you have to avoid using your teeth as a tool, you have to avoid negligence of oral oral hygiene practices. Okay, now what are the types of this tooth sensitivity I just mentioned earlier on? Now, first of all, we have the thermal sensitivity. Thermal sensitivity is when your teeth feels their temperature change, whether hot or cold. Okay, thermal sensitivity is when you feel that sensation when your teeth is exposed to hot or cold or extreme temperatures. Okay, now next we have the tactile sensitivity. The tactile sensitivity simply refers to when your teeth feel sensitive when under pressure, maybe when chewing or when eating hard food, and then you feel that shock and sensation. That's the tactile sensitivity. We also have the chemical sensitivity, which is when your teeth is exposed to sweet food or acidic food, you feel that sensitivity, or bitter food as well, you feel that sensitivity. And then finally, we have the osmotic sensitivity, when there is a change in the pH of the mouth. Okay, when there's a change in the acidity or alkalinity of the mouth, then you feel that sensitivity. That is an osmotic sensitivity. Okay, now what are the cures to this tooth sensitivity? Having discussed the causes and the types, definitely there must be a cure. Okay, and this is the most interesting part, because I want you to be cured and I don't want you to have tooth sensitivity. So hold on and listen. Now, the first cure for tooth sensitivity is desensitizing toothpaste. Okay, when you visit your dentist and you explain to him what is wrong with you, he's going to recommend a particular type of toothpaste for you. Okay, now this type of toothpaste, this desensitizing toothpaste, are normally high in fluoride content. Okay, because fluoride adds to the strength of the enamel. Fluorides improve the strength of the enamel and makes it more insensitive. Okay, so now we will give you a desensitizing toothpaste. Okay, now next is what we call the fluoride treatment. Okay, fluoride treatment, this is mostly done in the clinic. Also, when you visit your dentist, is going to recommend, is going to do you a fluoride treatment. And then an important point to note, if you are having tooth sensitivity, anytime you brush your mouth, you should not rinse your mouth with water. Okay, if you're having tooth sensitivity, anytime you brush your mouth, do not rinse your mouth. Why? So that the fluoride in the toothpaste will have enough time to come in contact with your enamel, thereby increasing the strength and quality of the enamel. Do you understand? If you're having tooth sensitivity, anytime you brush your teeth, do not rinse your mouth with water. You can rinse your toothbrush, you can wash the outer part of your mouth, but do not rinse the inside, so that the fluoride in the toothpaste will react with your enamel and increase the strength. You can keep spitting out, spitting out, spitting out until you feel good, but do not rinse your mouth. Now, the next remedy for tooth sensitivity is tooth filling. Now, actually, when your teeth is decayed, when the cause of your tooth sensitivity is caries or tooth decay, we are going to recommend tooth filling. Tooth filling is when we fill that part of your teeth that is decayed, or when we repair the teeth that is decayed or damaged. Okay, now we are going to actually fill up that place so that you do not feel the sensitivity again. Now, the next remedy for tooth sensitivity is what we call the gum grafting. Now, the gum grafting is a surgical procedure where we cut gums from other part of your mouth and we cover your exposed dentin, the exposed part of your dentin, so that it does not become sensitive anymore. Okay? Yes, that is actually a surgical procedure. You have to visit the clinic for that. Now we have the dental bonding. The dental bonding include the use of crowns and veneers to cover the dentin so that it do not become sensitive again. Okay, we are going to cover that part of the crown so that it does not become sensitive again. Okay, now you will also have to reduce your intake of sugary or acidic foods, right? For your own good, you will have to reduce your intake of sugary or acidic food. If you want to eat cake, if you want to eat candies and chocolates, you will have to reduce them, or make sure you brush immediately after consuming them, okay? Because they actually cause tooth decay, and then tooth decay will also cause tooth sensitivity. And then last but not the least, you have to maintain good oral hygiene, okay? You have to maintain good oral hygiene, because when you maintain good oral hygiene, your teeth and gums are going to be healthy, and then you will not be exposed to tooth sensitivity. Okay, from the look of things, it's like we've come to the end of this video. My name is Joel Jethro, and I'm happy to have you here. I would love you to please like, share, comment, and subscribe, and I would love to see you in my next video. Thank you for watching, and bye.